My name is Denise Wittich, and I am the mother of 4 children. I have a lovely husband, Peter Wittich. I was diagnosed with breast cancer in September 2004.
And in the fall of 2004, that was the fall, you will remember, where 4 hurricanes came into Florida. It was endless. Every week there was a new storm. I was running around town, closing up the office, getting ready for the storm, making reservations on Southwest Airlines to evacuate. So I've got reservations, we're ready to go. Denise calls me up and says, "Pete, you need to come over to Dr. Tuff's office." And of course I was incredulous and said, "Denise, do you realize how busy and crazy things are? I have no time right now to go to Dr. Tuff's office." And she said very calmly, she said, "Peter, you need to come to Dr. Tuff's office. I just spoke to him and he said he needs to speak to you."
And he told me that day, he said, "I'm sorry to say, but you have breast cancer."
When someone sits you down and says you have breast cancer, you're immediately stunned.
I really couldn't believe what I was hearing. Of course, the first thing you think of is, am I going to die? I mean, I have 4 young children. I had Sabrina, I think, was 4 years old. Jenna was 7. Courtney was 12, and 13 were Courtney and William. You feel as if you failed someone. I had a bilateral mastectomy on September 20th, 2004. Upon the pathology of my breast cancer, I was told also that I had HER2 disease.
The first doctor said that, oh, Denise might need to do some chemotherapy and she would maybe need to do some adriamycin. There's so much, so fast, you really have to take the time to say, I need to stop regular life for a moment and I need to concentrate on this one project. Hence, we came up with the Denise Project. Denise started chemotherapy, and I tell you, the courage that she exhibited is phenomenal. Denise had a lot of guts. She took her medicine. She was determined to get herself cleaned up, cured, and do whatever's necessary. I never heard her feel sorry for herself. I never heard any complaints from her. She did what she needed to do. Chemotherapy is nasty. Makes you ill. It is a terrible way to go through the day.
I don't even remember telling my kids. I think we just said, Mommy is gonna have to go to the hospital and have a little surgery, and from there she's probably gonna have to do some drugs that she might lose her hair, which is a horrible thing. I mean, I think the hair thing is the worst thing for a woman. Why? I don't know.
I was very unhappy with chemotherapy. I did not like the strategy of chemotherapy, and the results that I could glean from the literature was that the benefits of chemotherapy were really not that strong.
And a lot of women get chemo brain, which they call it, or chemo fog, and that's been a struggle.
I ran into publications that referred to the San Antonio Breast Cancer Symposium that occurs every December in San Antonio, Texas. And I signed up.
And my husband, being the husband that he is, who loves me very much and our family, wanted to do anything and everything he could. He disguised himself, basically.
I think Denise thinks sometimes that I dressed up in a white jacket and a stethoscope, but that's simply not true. I did register as Peter Wittich with the Denise Project as a researcher or professional in the field, but not as a doctor. I did run into a fellow at the Genentech booth, and Genentech is a biotech company that manufactures targeted therapies. And after hearing my story and what I was doing, he said, "Peter, you know what? I think I can help you out with a little bit." He says, we have this product, Herceptin, and it could be that this is the right fit for Denise. Well, Herceptin, of course, is a bioagent. And what it is it's a targeted therapy. There are some cancer cells in breast cancer that over-exhibit HER2, which is a gene which is expressed on the cell's surface.
And a doctor named Dr. Slamon invented the Herceptin.
Back in, I think, 1987, he published an article in Science magazine where he pointed out that women that had this overexpressive HER2 gene in their cancer had a much worse prognosis.
Where we've been is, when we first did the HER2 work, back in 1986-87, the assumption was because the disease arose in the breast or the lung or the colon, it was all the same disease. Nothing could be further from the truth. There are different ways to get breast cancer, and depending on what pathways are broken, that's the subtype of breast cancer you get. And to treat all of them the same was just flawed thinking.
And Herceptin had been approved, I believe, in about 1998 for metastatic cancers. And that is cancer that is spread to other vital organs of the body. And thankfully, Denise was not metastatic. She was still very much early stage. By using Herceptin to actually halt the spread of cancer in a metastatic patient, that demonstrates how powerful the drug or the bioagent really is, that it can stop a far-flung cancer. If you know that Herceptin works in a metastatic patient, you would presume that it's going to work beautifully in an adjuvant patient and prevent them and interrupt the cancer from going metastatic. That's logic. The doctors knew it would and should operate in that manner, but they didn't know to the extent what benefit would you get from Herceptin versus what side effects would you get from Herceptin.
Herceptin is considerably less toxic. In fact, you could argue it has no toxicity unless it's used with one particular chemotherapy drug, and then there's a certain incidence of cardiac problems that I think we can avoid completely now with some of the new regimens.